Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Ruth Ann Childers, who is the Director of Patient Experience at Baptist Health. Welcome.
Thank you.
Now, you've been at Baptist for a long time. You've done a lot of things, but now you're the Director of Patient Experience. What in the world does that mean?
I am, and I'm still the Director of Marketing and PR, but in 2018 I became the Director of Patient Experience, and we are the department that takes all that information that we get from the surveys that we send folks that we would love everyone to take when you get them, and we look at the data and look at ways that we can improve. And we strive to resolve anything that's happened. Our main goal is to help resolve anything that goes on with you while you're in the hospital or while you're at your appointment. And if that can't be done, then we strive to resolve things after you've left.
Okay, well, when you go to the hospital, you're sick and you want to come out well.
Yes.
But the patient experience is more than just being sick and coming out well. There's a whole lot that goes into that. Tell me something.
It is. We consider that the sum, patient experience, throughout the Baptist enterprise, all 9 of our hospitals, consider it the sum of all interactions that you have between the time that you call to make an appointment or present in the emergency department and the time you go home. And so we want all those interactions to be great at every Baptist facility, and you expect the same thing. But that comes from, like I said, everything from when you make an appointment or when you come in the ER unexpectedly to an unexpected surgery or a planned surgery. And it involves a lot of great communication. We always encourage people to communicate well with their caregivers because that also helps keep them safe. And so if you have issues while you're in the hospital, it's a good thing to talk to your nurse, to talk to the lab person, to talk to the food service person if that's something that you feel like would make you feel better, more at ease. As you said, no one comes to the hospital because they think it's fun, right? Even if you're going to have a baby, you're still anxious. So everyone that comes in the hospital has some kind of anxiety, and we're there to help make you not only feel better physically, but to help you through that journey.
Now, you also mentioned the term safety. That's a big part of the patient experience.
It is a big part of the patient experience. If you have a good rapport with your caregiver, your physician, the people from the lab, then you are more apt to tell them things that are going on with you that they might need to know to help you provide better care. So we encourage our staff, and we are very fortunate. I think everyone knows that healthcare staffing, this is a stressful time. It's a stressful time to be a nurse. There's more demand than there is supply. But we have been very lucky at Baptist for all these years to employ and have on our team really kind, compassionate people. And that's what we want, and that's what we want to see continue, because if you have that rapport with a kind, compassionate caregiver, you open up to them, you tell them things, you may tell them the thing that's going to help them save your life.
Well, you also mentioned when you were talking surveys, and when I get a survey, I think, I don't want to fill this out, or are you kidding me? They're not going to listen to them anyway.
Right.
But it is important. You do listen to it.
It is important, and they're shorter than ever. Okay, they used to be, back in the day, they came in the mail, they were 10 pages, had 68 questions, and now they're all electronic, so please give your registrar your email address or your cell phone number for a text message. They're all electronic, they're shorter. Every bit of that data is compiled into something that will help us take better care of you, whether it's a coaching opportunity for staff, whether it's a type of facility. I mean, you think of all the people. We were so excited to bring Hamburg, the hospital in Hamburg, the medical facility there, to Hamburg for all the people that want to come to Baptist, and how much easier that has made that for them than to drive all the way to Nicholasville Road. There are big things like that. There are small things like, perhaps there was a meal that they really wish they'd asked for that they didn't know we served. There are all kinds of things. Maybe they need more explanation about their bill. Maybe they needed something while they were there, communication. Maybe their mother lives in another city and they need to talk to their mother at noon, right? There are communication issues, things that just help. And we like people to answer the surveys, and very much encourage you to do that, because I promise you, we do look at everyone.
And if they have a concern, do they put on the survey? Do they call you? Do they? What happens?
Well, if you have a concern while you're there, okay, we encourage you to talk to your staff members, and don't feel like if you complain to somebody, they're going to be upset. Okay, that's not something we do, but you always have a right to talk to somebody from patient experience if you'd like that. Okay, if you've left, okay, and you've thought of something you want to tell later, you can call 859-260-6168 or just call the main hospital switchboard, ask to speak to the patient advocate, and we take your complaint, document it, and do our best to resolve it for you then. But we prefer to do it while you're there because that will be better. That would be a better experience for you during your healing.
Well, thanks for all you do, for all the care. They come in sick, yeah, and they go out well, and that's a good thing, but you make the experience good for everybody.
We try to, and I think Baptist reputation has spoken to how truly sincere Baptist feels about the patient having a good experience.
Thank you.
Thank you.
We'll be right back.